One of the things you said is if someone is aware that they have been raped, whether they're male or female, that they do not urinate. If
Correct.
they do, to urinate into a container. Why is that?
You want to preserve all evidence, just like any other crime. So as soon as you would determine that something has happened, you obviously would call 911, but you don't want to clean up the room you're in. You don't want to change your clothes. You don't want to brush your teeth. You don't want to do anything. Because once you get to the hospital, they're going to take what's called a rape kit, and they're going to use that to collect evidence. And so be honest with them. Tell them if you were drinking or if you were doing drugs, you got to let them know. But nothing justifies a rape. And so, yes, preserve. You have to go to the bathroom, preserve it. Put it in an empty water bottle or something, and get to a hospital as quickly as possible, because some of these drugs are out of your system quickly. Like GHB is out of your system in 12 hours. Some of the other ones, like rohypnol, can be detected in urine for up to 72 hours or so. So you don't want to take a chance that a key piece of evidence is going to be missed. So you don't want to clean up anything, yourself, your room, nothing, and then let the authorities, take it from there. And fortunately, if something does happen, then you have to look at getting some post-traumatic care and speak to a counselor or some sort of mental health professional to help with the healing process, because people are going to experience a range of emotions, guilt and fear and shame and anger and disbelief, and want to know, why did this happen to me? So you're going to have a hard time trusting people going forward when something like that happens. So it's very important to get help, not only during and in the immediate aftermath of something like that, but on a longer term basis.